We are going to do a video on best practices, COVID-19. In our culture and our traditions, we always start with a song or a prayer.
So prayer, guk stach guk de geld guk big de stach de twil guk je gemeenem gegeide stem na elia na twil je gemeene gelmug smaction spuuja swell selfwa stisen guk knochen guk ja guk stach guk gegeide stem.
Shushwa prayer. We thank you, Creator, for giving us this beautiful earth. Take care of everything on this earth. Take care of the people, the animals, the birds, the fish, the water, and the food. Help us to be strong. We thank you for giving us everything that we need.
I'm Lori Sellers. I'm the Executive Director of Three Corners Health Services Society. I'm here today to share some of the precautionary measures that are needed to address the COVID-19 pandemic.
I'd just like to say that the sickness that's going around, it's really bad, that we have to be really careful and make sure and stay home, stay in our house, our home, and not to travel too much. Right now, this virus that's going around is really deadly, and it could take your life, and especially the young ones that are still on traveling together, to be really cautious, make sure and stay a distance from each other. Look after yourself, exercise, eat properly, drink lots of fluids, and get lots of rest. Make sure and get lots of rest.
Hi, we are two of the community health nurses from Three Corners Health Services Society.
We want to remind you of the importance of good hand washing, especially during this time of the COVID pandemic.
The most effective way to wash your hands is with warm water and soap.
Please wash your hands thoroughly using warm water and soap for 20 to 30 seconds. Or you can time your hand washing by singing happy birthday 2 times.
Dry your hands well so that they don't become dry and cracked.
Applying a hand lotion or a skin cream will help to prevent your hands from becoming cracked and dry from the frequent hand washing.
If you don't have access to soap and water, you can always use an alcohol-based hand sanitizer, as long as your hands are not visibly dirty. This will also help to kill the germs.
Good hand washing is a key component to help keep us safe, and our families as well, and our communities, and keep us healthy.
Thank you and stay safe.
We look forward to being back in the communities with you, and we're here for you.
Hi, I just want to talk a little bit and remind everybody about social distancing. They say that 2 meters or 6 feet apart from everyone at all times. It's a safe distance and you can still socialize quite well, but 6 feet apart is what they're saying is the safest way to go at this time.
And when going out to pick up some essential items like grocery shopping or medications, please only select one person in your family to do that, and then still practicing social distancing.
And I know how anxious we all are to get together with our family and spend time close to one another, but right now, maybe hold off a bit, keep it to just family members living in the home, and when things are safer, we can all get together and have our parties and family celebrations.
As well, enjoying the outdoors, the sun, but still practicing the social distancing.
Hi, we're just here to remind everybody that we have a nurse call line that's available after hours at Three Corners.
5 till 8 p.m. Monday to Fridays, and on the weekends and statutory holidays from noon until 4 p.m. You can text or call that number and you will be directed to a nurse.
In addition to the nursing services, you can also get a referral to our mental health team, so any nurse answering the phone can direct you to any of our mental health team, so you can call with any questions you might have.
The other thing that we would like to remind you about is to make sure that your coughing into your elbow or into a tissue and throwing the tissue away, and that you are avoiding touching your face without clean hands.
So again, please give us a call with any questions, not just COVID questions, any questions at all. If you need help with your medications, just have a general question about anything, feel free to call us.
Hi everyone, my name is McLean. I work with the mental health team at Three Corners. We understand that the coronavirus pandemic is a scary time. There's a lot of fear and uncertainty around the future. We want to encourage you to reach out to your friends, reach out to your family members, reach out to elders. A great way to stay connected is to use social media, to FaceTime, to pick up your phone. We also want to remind people that social media and the internet can be a great source of stress for many people. There's a lot of information circulating right now that can add to anxiety, and our services still remain available to you. We're here to support you, and we want you to reach out to us. I'm going to just go over the programs and the services we have available at the office. So we have a mental health and addictions counseling program. It's ran by our manager Lynn, and Nalina is also a counselor. We have a family connections program. It's run by Barb and Mary. We have a wellness through culture program for men that's run by Chris. And we have an integrative therapy program that's run by CL. Lastly, we have a youth connections mental health support and counseling program that's run by me. Please reach out to us if you need extra support. You can contact the office Monday to Friday, 8:30 to 4:30 at 398-9814 and ask to speak with a mental health team member. You can also call the nurses line after hours and request for one of us to follow up with you as soon as possible. Please stay safe. Please continue to socially isolate and socially distance, and close your laptop, turn off your phone, get out, enjoy the beautiful sunshine. Stay safe, we're in this together, and we're here for you.
We're here for you. Look after your families. Look after yourself. Don't forget to eat. Get enough sleep. You exercise. You rest. And if you need any malaman and supports and any education, we're here for you. Look after yourself. Thank you.